Tonight, the Delta variant of COVID-19 is on its way to becoming the dominant strain in a number of states.
Doctors say those trends help predict what we'll likely see in Georgia soon. In less than a month, the Delta strain grew from 10% to 30% of all COVID cases in the United States. We know you have questions, so Caitlin Ross talked to an infectious disease expert about some of the most common questions people have and are looking for answers on Google. You're better than Google. Tell us what we need to know.
I'm going to try here, but there are a lot of questions because people are really curious about this. They want to know how many cases of the Delta variant are in Georgia and how this is going to impact their families. On Google, one of the most asked questions is if people should take more precautions or wear masks again as this variant spreads. And Dr. Morgan thinks you should think about it.
It certainly is worth reconsidering in light of the fact of regional differences in vaccination rates.
A lot of you have Googled whether the vaccines are effective against the Delta variant. Dr. Morgan says it depends on which vaccine you got. Pfizer and Moderna have proven to be about 88% effective against the variant, while the data on the one-dose Johnson & Johnson shot has not yet been published. For that reason alone, she thinks people should remain cautious.
And so what has happened is not only did the vaccinated unmask, but the unvaccinated unmasked as well. And so now it's unclear who's who.
So there is some good news here. The Delta variant only accounts for about 0.4% of the infections here in Georgia. The Alpha variant is far more dominant with 60% of those infected. However, anytime you're in a big crowd now, our numbers in Georgia show about 60% of the people around you likely are not vaccinated. So as this variant spreads, they're urging people to continue to wear masks, social distance, and wash their hands frequently.
All right, as much as people want to break those routines probably need to stick around for a while longer. Caitlin Ross, thanks a lot.